السلام عليكم. اليوم respiratory system examination. Today respiratory system examination. Before you start any examination, we have introduction. Okay, patient privacy, washing your hand, introduce yourself, take permission, and so on. This is general for all type of examination. Concerning respiratory system examination, general observation for your patient in form of breathing, wheezing, voice, mental status, breathing, distress, and so on. This is general observation. Then start by hand, finger clubbing. Look or search for finger clubbing and remembers all other causes of finger clubbing. Okay? Concerning respiratory and other system. Okay? Then look for nails color, discoloration of the nails, wasting of the small muscles of the hand, Bankos tumor, which concerning Horner syndrome. Okay, also concerning Horner syndrome. Pulse, look for do pulse, tachycardia, and so on. Searching for pulses paradoxes in severe asthma. Therefore, you have to check for pulse. Okay, this hand finish. Then came to the face. In the face, we have to look for Horner syndrome, central cyanosis, pursed lips, if the lip pursed or not in case of severe COPD. Neck. In the neck, searching for GVP. Causes of raised GVP in respiration. In form of core pulmonary, raise intrathoracic pressure in case of tension pneumothorax and acute severe asthma, massive pulmonary embolism, and superior vena cava obstruction. All these causes can lead to raise GVP. After GVP, look for lymph node, look for accessory muscles, use of accessory muscles of respiration like sternocleidomastoid and scalenus muscles and so on. Okay. Then examination of the chest. We finish hand, face, neck, chest. We want to examine the chest. Remember, in examination of the chest, you have to remember two main things, which is during palpation or before you start palpation, you have to check for the pain. Ask the patient for the pain. And remember, in the chest examination, inspection, palpation, percussion, auscultation, all this you do in front or for the chest, you have to do it for the back of the patient. Okay? Let us to start by inspection. Inspect your patient respiratory rate. It is high or low respiratory rate, type of your respiration, it is thoraco-abdominal or abdominal thorax, and so on. Shape of the chest. This shape of the chest could be a parallel chest, it could be pectus excavatum, and so on. The shape of the chest, we finish prominent vein. Look if there is prominent vein or not. Movement of the chest, it is symmetrical or not. There is diminish in one side or not. Look for this important point. And then palpation, palpate for trachea. It is in a normal side or not. Look for patient that deviates the trachea towards the side of the lesion and away from the side of the lesion. You have to search for these causes. Okay, tracheal tach and so on. Position of the apex, the apex speed position. It is in a normal side or it is abnormal displaced, okay, or not palpable. Chest expansion, reduce or increase, reduce expansion on one side or in bilateral side. There is causes that reduce the chest expansion in one side and other causes in both sides. Tactile vocal firmness increase and decrease due to what? Okay, percussion. You have to percuss looking for resonance, hyperresonance, impaired percussion, not fibrosis, dullness, stony dullness, liver dullness, or tidal percussion. Okay, sometimes you have to look for cardiac dullness. Auscultation, breathing sound, normal or not, in form of intensity, normal or increase or diminish, diminish in intensity of breathing sound. Quality for vesicular or bronchial breathing. It is vesicular or bronchial breathing. Okay. Add sound for wheeze and crackle and pleural rub. Vocal resonance, degrees increase, agophony, whispering, pictoronecry. You have to look for all this and do summary for your examination and do all this for the back of the patient. Okay. And at the end, thank you very much till we see you. Thanks.